This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome to the 21st Century Man podcast. We're your guide digging into the really practical insights from the book, The 21st Century Man.
Great to be diving in again.
Yeah, absolutely. Today we're tackling Chapter 78, Orgasm. Too fast, too slow, or just right?
A big topic for sure.
Definitely. And our mission really is to pull out the key actionable stuff about the male orgasm, looking at common issues like premature and delayed ejaculation.
And we'll break down some of the, let's say, more complex science into things you can actually use right from the book.
Exactly. Because the 21st Century Man, it's just such a valuable resource, isn't it? It really empowers you with knowledge.
It absolutely does. It connects that scientific understanding with, practical advice, makes sense of things that often feel a bit mysterious.
Totally. And speaking of the ultimate experience, Woody Allen had that great line, right? In my next life, I want to live backwards, start out dead, and finish off as an orgasm.
Hey! Yeah, it captures something, doesn't it?
It really does. But what's fascinating, and the book points this out, is that this huge pleasure isn't just like random.
Right. Evolutionarily speaking.
Yeah, the author talks about being on safari, seeing this male zebra fight off 6 others for hours just for the chance to mate.
Wow. That's intense.
It shows how powerful that drive to procreate is and why orgasm evolved to be so incredibly rewarding. It's like evolution's big reinforcement mechanism for, well, ensuring the species continues.
That's the perfect evolutionary frame. And the actual human sexual response, it's pretty intricate. It has those 4 stages: desire, arousal, orgasm, and resolution.
And orgasm itself is the shortest stage.
Shortest, but definitely the most intense. And even within that, there are really 3 distinct physical phases happening: emission, expulsion, and then the sensation, the orgasm itself.
Okay, emission, that's the first physical step. What's happening there exactly?
So during emission, seminal fluid, which comes from the prostate, and these glands called seminal vesicles, they make most of the fluid, starts moving into the urethra. And crucially, your body automatically closes off the bladder neck right then.
Oh, right, so everything goes the right way.
Exactly. Prevents semen from, spilling into the bladder.
And this is all automatic, not something you consciously control.
Precisely. It's all orchestrated by your autonomic nervous system. It's a marvel, really.
Yeah.
And if anything messes with the nerve supply to those pelvic muscles, it can actually interfere with this early stage.
Okay.
Then as emission starts, your sympathetic nervous system kicks off this whole biochemical cascade.
Ah, the chemistry part.
Right. You get a surge of noradrenaline, but especially oxytocin. Levels can triple after orgasm, then drop back down in about 10 minutes.
That's the bonding chemical people talk about.
That's the one, yeah. Helps bring couples together. You also get more serotonin, the happiness chemical, and prolactin levels go up.
Prolactin, what does that do?
That promotes sexual satiety, kind of decreases arousal after orgasm, the winding down phase.
Got it. So it sounds like, and this is interesting, orgasm and ejaculation aren't exactly the same thing, even though they happen together.
That's a really critical distinction, actually. And yeah, it's a common misconception. Orgasm is the sensation, that intense pleasure, the altered state of consciousness.
Oh, okay.
Ejaculation is the physical process, the emission and expulsion of semen, ultimately designed for procreation.
Right.
Think about animals in the wild. Rapid ejaculation lets them mate and then quickly get back to safety.
Makes sense. Survival first.
Exactly.
Yeah.
But humans, well, we often have sex for connection, for pleasure, way beyond just making babies. So understanding that difference is important.
Yeah, that really clicks. And the feeling itself, orgasm. There's no single, official definition, but you definitely know it when you feel it.
Oh, absolutely.
That faster breathing, heart racing, blood pressure up, and those specific pleasurable contractions in the pelvic floor base of the penis. Unmistakable.
Totally unmistakable. And the physical output, the ejaculate, it's pretty efficient. Average volume is only about 3/4 of a teaspoon.
Huh. Smaller than you might think.
Yeah. And for younger guys, it can project quite far, maybe 12 to 24 inches. Gives the sperm a head start,
Yeah, it's head start, right.
Yeah.
But that force lessens with age.
It generally does, yeah. Unless you actively exercise those pelvic floor muscles. That can help maintain it.
Which brings us to expulsion, the actual propulsion part.
Right. Expulsion is this powerful spinal cord reflex. It's the real point of no return.
Okay.
And it absolutely depends on strong contractions of the pelvic floor muscles, especially the bulbocavernosus and ischiocavernosus muscles right at the base of the penis.
And then the final phase is that rhythmic pulsing.
Exactly. Rhythmic contractions of those same muscles about once per second, propelling the semen out through the urethra.
It's amazing when you break it down. Such intricate coordination.
It really is. Emission, expulsion, orgasm sensation. The survival of the species depends on this dance being pretty much perfect.
Which I guess also explains why things can feel off if one part isn't working right.
Precisely. And that leads us nicely into one of the most common challenges, when the timing feels too fast. Premature ejaculation, or PE.
Right. And the book immediately tackles something huge here. The pornography myth.
Oh, yes. So important to address that.
It's just so easy to get unrealistic expectations from watching porn, isn't it? You see these actors, multiple takes, maybe performance-enhancing drugs.
It's absolutely not reality. And managing expectations based on that is crucial for dealing with PE.
So how is PE actually defined? Is there a strict time limit?
Well, the International Society for Sexual Medicine often uses about 1 minute after penetration as a benchmark. Other researchers might say 2 minutes. Some studies go up to 4.
So it varies a bit.
It does. But crucially, PE is also about perception. How satisfied is the man himself? How satisfied is his partner? That subjective experience really matters.
Okay. And how common is it? What are the numbers?
Generally, men without PE last around 5 to 7 minutes, but the data suggests maybe 30% of men experience PE at some point.
30%? Wow.
Yeah. And consider this. Women, on average, take about 17 minutes to climax. So you can see the incentive for men wanting to last longer.
Definitely. And here's where the 21st century man is, I think, really groundbreaking. For ages, PE was seen mostly as psychological, right? Like a source of shame.
Yes, largely blamed on anxiety or relationship issues.
But this chapter flips that script. It lays out a whole list of physical things that can cause PE, like an overactive thyroid or smoldering prostate infections, even weak pelvic floor muscles.
And that's incredibly empowering because many of those physical conditions are actually treatable. It shifts the whole perspective.
It really does. Is there a genetic component too?
Seems like it. Twin studies suggest maybe 30% of PE might be genetically based. The book breaks PE down into 3 main types.
Okay, what are they?
There's lifelong PE, which means it's been there since the very first sexual experience that points towards a possible genetic link.
Right.
Then there's acquired PE.
Yeah.
This develops later in life, maybe due to a health issue, aging, or some imbalance in body chemistry like low serotonin or low testosterone.
Okay, acquired. And the third?
Variable PE. This is when ejaculation timing is normal sometimes, but premature other times. It's often considered, within the normal range of variation.
And the impact of PE. It's not just about the timing, is it? It can cause real distress.
Absolutely. It can lead to frustration, avoiding intimacy, hitting sexual confidence hard, and negatively affecting relationships for both partners.
Yeah. The book mentions Chapter 88, How to Please a Woman, has more on partner satisfaction too.
Good point. So let's dig into the causes and the solutions the book offers. First up, hypersensitivity, nerve function stuff.
Right, where even a little stimulation leads to climax really fast. What causes that?
It could be the sheer number of nerve endings in the glands, the head of the penis, or the frenulum, that little band underneath.
Huh. More nerves.
Potentially. A study in China actually found men with PE had, on average, 7 nerves in one sensitive spot compared to just 2 in men without PE.
Huh.
Also, being less sexually active might increase sensitivity, and low serotonin activity seems linked to lifelong PE.
Okay, so what can you do about hypersensitivity? What are the try-this-at-home options?
Well, first, simple things. Lubricants, especially silicone-based ones like Uberlube, can reduce friction, giving you a bit more control.
Makes sense. What else?
Condoms. The latex itself provides a barrier that dulls sensation slightly. Plus, some condoms actually contain numbing agents like lidocaine or benzocaine.
Oh, interesting. Numbing condoms.
Yeah. Or you can use numbing creams or sprays directly. Things like Promescent, which is lidocaine-based. You apply it to the frenulum maybe 5-10 minutes beforehand.
Does that work well?
It can delay orgasm by, say, 1 to 4 minutes for many guys. But here's the really crucial tip. Wipe it off before intercourse. You don't want to numb your partner, too.
Huh. Good point. Very important. Okay, what about techniques?
Sensory therapy techniques can be really effective. There's the classic start-stop technique.
How does that work?
You stimulate yourself until you feel that urge to ejaculate getting close. Then you stop completely until the urge fades, and then you start again. Repeat a few times.
builds control over the sensation.
Exactly. And then there's Masters and Johnson's famous squeeze technique. When the urge builds, you or your partner firmly squeeze the glands, the head of the penis, until the urge subsides.
Okay, the squeeze.
Yeah.
And one more simple one.
Just masturbating an hour or two before sex can sometimes take the edge off, make you less sensitive later on. Assuming, of course, you can get an erection again relatively soon.
Right, depends on the refractory period.
Yeah.
And medically, for hypersensitivity.
There's a procedure mentioned, done in China, called dorsal neurectomy. They actually sever some of those extra nerves to reduce sensitivity. Apparently, it can cure PE while keeping normal sensation otherwise.
Wow, that's quite something. Okay, moving on from nerves. Body chemistry.
Yeah, this is a big one, and often checkable with simple blood tests. High thyroid levels, for example.
Really? Hyperthyroid can cause PE.
At least 50% of men with hyperthyroidism experience PE. But the good news is, normalizing those thyroid levels often brings rapid improvement, cures it in over half of cases.
That's huge. Easy to check, too. What else in chemistry?
Low brain serotonin. Poor transmission of that happiness chemical. Interestingly, some recreational drugs, opioids, amphetamines, cocaine, can actually increase PE.
Huh. Counterintuitive.
Yeah. Specific genes seem involved too, but about 2/3 of men seem to respond well to either SSRI medications or St. John's wort.
SSRIs, those are antidepressants, right?
They are. We'll come back to those. And low testosterone. The evidence is a bit mixed, but one Turkish study showed testosterone replacement therapy increased intercourse duration by almost 5 times.
Significant. So for body chemistry, what's the try this at home advice?
Purple therapy is mentioned, specifically St. John's wort.
As a natural antidepressant.
Exactly. It can boost mood and serotonin levels, potentially helping PE without the side effects some people get from pharmaceutical antidepressants.
But you have to be careful with interactions.
Absolutely critical. Always, always check for interactions with any other meds you're taking. Use a reliable source like drugs.com. The book also mentions Prelong by Affirm Science, a specific St. John's wort extract for PE.
Okay. And if the home stuff doesn't work, then medical approaches.
First, get those thyroid levels checked. As we said, normalizing them makes a huge difference. Then, SSRI antidepressants, things like Prozac, Zoloft, Paxil, Celexa.
They're prescribed for depression, but they help PE how?
They have a known side effect of delaying climax. On average, maybe by 75 seconds.
Okay. Downsides.
You generally have to take them daily, and they can have side effects like decreased libido, fatigue, nausea for some people.
Right. Are there other options?
There are fast-acting SSRIs like Prilogy or Duloxetine. Its short half-life means you can just take it an hour or two before sex. Much better for targeted use.
But it's not available everywhere.
Unfortunately, no. Not FDA approved in the US, for example, though available elsewhere.
What about things like Viagra?
PDE5 inhibitors like Viagra can sometimes help indirectly by reducing performance anxiety and stress hormones, which can contribute to PE.
Okay, and injections.
Penile injection therapy exists. It involves injecting drugs to dilate blood vessels for a strong erection. It doesn't delay ejaculation itself, but it does allow a man to maintain his erection even after ejaculating, so intercourse can continue if desired.
Interesting workaround. Okay, next cause. Muscle tone of the pelvic floor.
This is a surprisingly common factor. A lot of men with PE just have low tone in those muscles and aren't really aware of them.
Like, they don't know how to control them.
Pretty much. An Italian study used biofeedback training where you get visual feedback on your muscle activity and exercises. They actually cured 54% of men with lifelong PE just by increasing their awareness and control.
Wow. So try this at home is Kegels for men.
Exactly. Kegel exercises. First step is identifying the muscles.
How do you do that?
The easiest ways are to try and stop your stream of urine mid-flow, or to tighten the muscles you'd use to stop yourself from passing gas. Those are the pelvic floor muscles.
Okay, found them. Then what?
Practice contracting them, hold for 3 seconds, then relax for 3 seconds. Try it in different positions, sitting, standing, lying down.
And importantly,
only tighten those pelvic floor muscles, don't tense your abs or your butt muscles, and breathe normally, don't hold your breath.
right, make it targeted. And do them regularly.
Yeah, integrate them into your day. Do a set at red lights, during TV commercials, after you pee. The book outlines a multi-step training approach, too. Awareness first, maybe with biofeedback, then practicing contraction without stimulation, then learning to time it during sex, and finally, ongoing strengthening.
And if Kegels aren't enough,
There's the Emsella chair by BTL. It's FDA approved and uses strong magnetic fields to basically force those muscles to contract powerfully. There's a specific protocol for men to improve pelvic floor control.
Technology to the rescue. Yeah, what about general health issues?
Definitely a factor. Chronic infections of the prostate or urethra can cause PE. Antibiotics often clear it up. Prediabetes and diabetes are linked to about half of diabetic men have PE.
Why is that?
It could be related to weight gain, being sedentary, maybe leading to poor pelvic floor tone. Also, neurological conditions like MS, spinal cord issues, neuropathies, or even nerve damage from trauma or surgery can impact ejaculation control.
Right, lots of potential physical causes. Which brings us to the last category, psychological issues.
And this is where perception really comes into play again. It's not just about the stopwatch.
Meaning?
Well, some men might ejaculate quite quickly but feel totally fine about it. They wouldn't call it PE. Others might last longer but still feel dissatisfied and do consider it PE.
So it's subjective. Influenced by porn fantasies, maybe? Cultural ideas? Partner satisfaction?
All of the above, which is why mind-body therapies are important.
Like psychotherapy?
Yes. Therapy can help unpack relationship issues, anxiety, fear, things that might be contributing. One Spanish study showed psychotherapy alone helped men last longer, up to about 7.5 minutes compared to 3.5 minutes with just medication.
That's a big difference. What about tantric sex?
Tantra is mentioned as a powerful approach. It involves deliberately slowing down intimacy, focusing on breath, really attuning to each other. It's about experiencing sexuality differently, less goal-oriented.
More about the journey.
Exactly. Heightens pleasure and intimacy, adds a spiritual dimension for some, and crucially, it includes specific training in breathing, sensory awareness, and relaxation techniques to gain voluntary control over those pelvic floor muscles right before ejaculation.
Fascinating. Okay, so we've covered too fast pretty thoroughly.
Yeah.
But what about the other side of the coin? When it's too slow or it doesn't happen at all? Delayed ejaculation, or DE?
Right. While PE gets a lot of attention, DE is a significant challenge for a surprising number of men. It's when it takes a very long time to climax, or you can't climax during intercourse at all.
What causes that? Are the causes similar to PE or different?
Quite different, often. Biologically, age is a factor. Things tend to slow down naturally. Low testosterone or low thyroid levels can contribute here too, just like with PE sometimes. Alcohol before sex is a common culprit for delaying things.
The dreaded whiskey dick effect may be related.
Could be related, yeah. And medications are a huge factor for DE.
Which ones?
A whole range. Things like 5-alpha reductase inhibitors for prostate issues, alpha blockers, certain anticholinergics, and importantly, antidepressants, especially SSRIs, are well known for causing delayed or absent orgasm. Opiates, too. Always check medication side effects.
So the same SSRIs that can help PE can cause DE.
Exactly. It's a balancing act. What helps one problem can cause the opposite. Physical health issues can also lead to DE.
Like what?
Infections, urethra, prostate, testicles, nerve or nervous system problems are big. Diabetes, MS, spinal cord injury, effects of prostate surgery or pelvic radiation, even physical abnormalities present from birth or nerve damage from certain cancer surgery.
Okay, so a lot of potential physical roots.
And psychological, yes, definitely. Depression, other mental health issues, unrealistic expectations, maybe real sex doesn't live up to specific masturbation fantasies, anxiety about pregnancy, performance anxiety again, fear of intimacy, conflicts about sexual orientation, feelings of shame or guilt, all can play a role.
A complex mix. So what can you do if you're experiencing DE? What are the try this first suggestions?
Well, strengthening the pelvic floor with Kegels comes up again. Stronger orgasm muscles can help achieve climax. The book suggests checking out privategym.com for specific programs.
Okay, Kegels again. What else?
Relaxation and breathing exercises. Techniques like tantric yoga can help coordinate the mind-body connection, allowing you to focus better on pleasure rather than anxiety.
Makes sense. Less pressure, more sensation.
Precisely. And then there's something maybe unexpected, male vibrators.
Really? Vibrators for men dealing with DE?
Absolutely. Just like they help many women reach orgasm, they can provide intense targeted stimulation that might be needed. The book shares a great story about a couple where the man used to take like 3 hours to ejaculate during intercourse. Extremely frustrating for both.
Wow, 3 hours.
Yeah. But they tried a male vibrator, mentions Fun Factory as a source, and suddenly he could orgasm in about 20 minutes. Huge relief and happiness all around.
That's incredible. A simple tool making such a difference. Okay, so if those first steps don't work,
Then it's time to look deeper, especially at body chemistry again.
checking hormones.
Yes, get free and total testosterone checked. Aim for 400 nanograms per deciliter or higher, the book suggests. Check thyroid levels too, and supplement if needed.
And the SSRI issue.
If you're on SSRIs and experiencing DE, definitely talk to your doctor about it. Maybe switching meds or adjusting the dose could help, or exploring other therapies for the underlying depression or anxiety.
Okay. What about medical approaches for strengthening muscles beyond Kegels?
The Emsella chair comes up again here too, that magnetic muscle stimulation we talked about for PE.
Yeah.
It can also help with DE by strengthening those crucial pelvic floor muscles involved in orgasm.
So it helps on both ends of the spectrum.
It seems so. The author actually did a clinical study showing it improved the intensity and duration of orgasm in men.
Interesting. And therapy.
If psychological issues are the main barrier, sex therapy can be very effective in targeting those specific blocks or anxieties preventing orgasm.
And the pornography factor you mentioned.
Yeah, if someone's overly reliant on very specific or intense porn fantasies for arousal, real-life sex can sometimes feel underwhelming, making orgasm difficult.
So readjusting expectations is key.
Definitely. Getting back in touch with what normal or typical sensation feels like rather than chasing a fantasy. Cognitive behavioral therapy, CBT, or even hypnosis can be helpful tools if porn addiction is a contributing factor.
Wow. Okay, we have covered a ton of ground here, really diving deep into Chapter 78, from how orgasm actually works mechanically and chemically to very practical solutions for PE and DE.
It's incredibly detailed in the book. It really highlights how understanding your body, your mind, and knowing there are options is just crucial for a satisfying, intimate life.
Absolutely. And the 21st Century Man does such a great job of blending that science with stuff you can actually do.
It really does. It's not just abstract knowledge. It's about application, about taking control. We really hope listeners will grab a copy and explore this even more themselves.
Yeah, highly recommended. So wrapping up, what's the main takeaway here for anyone listening who might be struggling with too fast or too slow?
I think the biggest thing is don't feel ashamed. These are common issues and there are solutions.
Right. Don't be afraid to seek help, whether it's trying something simple at home, talking to your partner, or seeing a doctor or therapist.
Exactly. And don't be intimidated to try something new. You know that famous quote from Wayne Gretzky, or maybe Michael Jordan said it too.
You miss 100% of the shots you don't take.
That's the one. It applies here too. You deserve pleasure and satisfaction in your intimate life. Take the shot.
Great final thought. Well, that's all for this deep dive. Join us next time on the 21st Century Man podcast, where we'll be exploring Chapter 79, a comprehensive approach to sexual function.
Looking forward to it.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.